departments have been releasing very little demographic information about people who test positive for COVID-19 and the people who are dying after being infected. But some states, counties, and cities are releasing more demographic data that show, in some places, a hugely disproportionate effect on African Americans. During our discussion now, NBC News correspondent Morgan Radford. Morgan, what do we know?
Well, Lawrence, we know that this is a crisis within a crisis. If you actually look at the data, it shows that COVID-19 affects people of color at disproportionately high rates and is essentially a ticking time bomb. And what's interesting is that the CDC doesn't actually share the racial breakdown of its data, but certain cities and certain states do, and those numbers are alarming. If you look at the entire state of Louisiana, for example, 70% of the people who die from COVID-19 are Black people. If you look at the state of Michigan, 40% of those deaths are African American, and that's in a state that only has a 14% population of Black people. Then if you look at Blacks and Latinos in places like Milwaukee, they account for 78% of the deaths. And if you look right here in New York City, 56% of the deaths are concentrated in the Bronx and concentrated in Queens. And as you know, those are both majority and minority communities. But what's interesting about all this, Lawrence, is when we talk to experts and we talk to people who were personally affected by this virus, they point to three contributing factors: health, jobs, and most surprisingly, misinformation. Take a listen.
There was a little bit of like, oh, Black people can't get it, right? Well, I got it. Look, I think it's gonna get really bad for Black America, right? That's just a fact.
I'm your typical average healthy millennial, and this virus had me barely able to stay awake because my body was burning up. I had a winter hat on in my own home. There was so much misinformation being pushed to our community, and people are sharing it out of fear. They are sharing it because they do not trust a number of systems and political leaders that should be there to protect us. If it hurts the white community, it can kill the Black community.
So breaking down those three factors, when you talk about health, the CDC says those pre-existing conditions that make COVID-19 deadly, like heart disease, diabetes, asthma, those are already overrepresented in Black and brown communities. So it's not like Black people are more susceptible to getting the virus itself, it's that they're disproportionately affected when it comes to those severe or deadly complications. And then secondly, when it comes to jobs, they're overrepresented in those direct contact service jobs. And finally, the CDC had to actually create a web portal trying to dispel those myths, things like Black people couldn't get it. So that's why we're seeing those numbers as high as they are, and it's a cause for concern. Lawrence?
Morgan Radford, thank you for your reporting. Today, Chicago Mayor Lori Lightfoot said the Chicago Department of Public Health statistics show, quote, 72% of Chicago's deaths have been among Black Chicagoans, though Black Chicagoans make up just 30% of the city's population.
Those numbers take your breath away. When we talk about equity and inclusion, they're not just nice notions. They are an imperative that we must embrace as a city. And we see this even more urgently when we look at these numbers and this disparity. It's unacceptable. No one should think that this is okay.
Joining us now is Chicago Mayor Lori Lightfoot. Mayor Lightfoot, you must have had a feeling that this was what the numbers were going to show even before the data was assembled, with this overwhelming impact on African Americans in Chicago. Do you have any working theory about why it is?
Well, I think the reporting that you just showed, which is when you have all these health disparities pre-COVID, where you got a disproportionate number of people in the African American community with diabetes, with heart ailments, with respiratory problems. This disease attacks and feasts on those underlying conditions. And that's what we're seeing manifested on the numbers. I mean, it's breathtaking. When I first saw these numbers, I had a hard time thinking about anything else because I knew that this was going to land like a bomb and that we had to come up with some concrete, rapid responses to help people in these communities.
And there hasn't been any emphasis on this or even a word about it as far as I know. at the White House briefings, which are the most prominent kind of public transfers of information about this. And yet we heard in the report just now that there has been a lot of misinformation out there. Do you have any sense of what kind of misinformation there has been in the Black community?
Well, I think there's been misinformation that Black people can't actually get the virus. And the truth is, in Chicago, the first reported death was an African-American woman who then gave it to her sister, who then also died. So the numbers speak for themselves. The fact that Black people are dying at 7 times the rate of any other demographic is stunning. It is a red alarm, an alert that we've got to respond to, and we are in our city.
And Mayor, how do you respond to it in terms of public information? What is the message you want to get to African Americans, and how do you deliver that message both in Chicago and beyond Chicago?
Well, what we've done is we've formed a strike force, and it's going to be hyper-local, targeted outreach to people of color, and particularly Black folks, in their neighborhoods. We're going to be calling upon the faith community, elected officials, street outreach workers, people in block clubs to get the word out and then connect people up with services. We've been saying, 60 or over, we're going to lower that to 50 or over in the Black community and really focus on getting people tested, getting them supports, talking to them about what they can do to protect themselves. But we've got to reach more people and quickly.
Mayor, how is the hospital system in Chicago bearing the burden so far?
Well, so far, we're okay. We've been tracking ICU numbers overall, the number of people in ICU beds that are tested positive, the number of people under investigation for coronavirus that are in ICU beds. We've been hovering around 75, 76%. Over the last couple of days, it's dipped down to about 71%. But we know that we are far from out of the woods. We're concerned, of course, like everybody is, about ventilators, PPE, and testing. We are not testing nearly the number of people that we should be, and this is one of the tools that we're going to have to employ in thinking about how we reach Black people. We've got to bring more testing to those neighborhoods so we understand what the underlying data really is. And the last thing I'll say is we've got to make sure that our healthcare providers are providing us with the demographic information. As stark as these numbers are, we know that we're missing 20%, 25% of the demographic information on testing that's positive. So we've got to really ignite the consciousness of our healthcare providers to make sure they give us that demographic information.
Chicago Mayor Lori Lightfoot, thank you very much for emphasizing this crisis publicly and helping us emphasize this point that really has not been part of the national discussion as it should be so far. We really appreciate it, Madam Mayor. Thank you.
Thank you.
And joining our discussion now is Dr. Vanessa Northington Gamble. She's a physician and a historian of race and American medicine. She's a professor of medical humanities at George Washington University. And Zeke Emanuel is back with us. I'm just going to get out of the way so the two medical professionals can talk to each other about this.
Dr. Gamble, you have seen these data and you've dedicated your life to erasing the disparities in healthcare between African Americans and whites. What do you think would be the most effective way both to educate the community, to get them to practice physical distancing, and really to wipe away this horrid disparity?
I mean, Zeke, I think the first thing we need to do, and the mayor brought this up, is release the data. I mean, Chicago is one of the few places, Illinois, North Carolina, and Michigan are the few places that release data to racial data with regard to coronavirus. So I think we have to have this information to work with particular communities so that they see their faces. They see their neighbors dying, but at the same time, they don't see our leaders talking about this.
And how should we educate them about the correct practices to protect their lives, really?
I mean, I think, first of all, I think that we have to be real here, because we tell people stay home and social distancing. A lot of people can't stay home. Some and work from home. But if I am working in food service, if I am working in janitorial services, I cannot stay home. I have to, in Philadelphia, I have to take the L. I have to take the subway in New York. So in terms of our messaging, we have to be, when we tell people stay home, and also when we tell people to social distancing, so I think that we have to be very clear with ourselves about what we are saying to people. And at the same time, we have to educate, not just people of color, we have to educate our leaders. We also have to educate medical professionals that this is not just a medical issue. This is a social justice issue. And one of the things that we are now seeing is that we are seeing the fault lines of hundreds of years of social inequalities.
Do you think there's something the medical system can do this moment to sort of treat African Americans better? Is it that they need to go into the community to do more testing and make people aware that way?
Well, first of all, I have to hand it to my colleagues who are in places like the Bronx and Queens, who are on the lines taking care of poor people and Black people. I have to hand it to them. But at the same time, I think we also need to work with communities to find out, what they need. What's the best way? I mean, one of the things that's happening in Milwaukee and also in Chicago is trying to find those leaders within the communities that can help spread the message.
Dr. Vanessa Northington Gamble, thank you very much for helping us emphasize this very important issue tonight. We really appreciate it.
Thank you very much.
And when we come back, we'll get a last word from Dr. Zeke Emanuel on when we might return to normal and what normal might look like. But first, there has been a national outpouring of well-deserved support, admiration, and gratitude for our brave medical professionals who risk their lives every day to save lives in this pandemic. We give them a special thanks tonight with thank you notes sent to them from all over the country and read by the healthcare professionals who received those thank you notes.